I wanted to just find out first, is there anything specifically you would like some feedback on in this segment?
Basically, I know I don't give the student a chance to fully explain their answers. I'm very eager and I sometimes interrupt them. I also feel that I don't transition from what they're saying to the next topic I want to explore.
Okay, so you say you interrupt students? And
I do.
Yeah.
I know that I do.
Okay, and you don't let them transition?
I don't transition.
You don't
I mean,
transition?
they're telling-
Okay, is there anything else that you'd want to talk about or explore besides that?
I probably don't make them self-reflect enough. I probably am very anxious to spoon feed them, which I know is...
You're anxious to spoon feed them?
Yes,
Huh,
that's
okay.
my MO. I really do.
Yeah.
I
Okay,
want that-
well, let's take a look and see if how this works, and or if we see what you're talking about. But stop me anytime, and
Sure.
I'm going to ask you some questions, and you can ask me some questions. I'm going to just try to figure out with you what you're doing.
How do you feel about the questioning technique?
Okay, before we get into that, first, how are you feeling when this started?
When a student
Yeah.
gives me an answer like I was very happy with what I
Yeah.
did, I sort of have to struggle with where to go next. If
Yeah.
she's very happy, then I wonder whether I should at that point say what particularly made you happy about your encounter.
Exactly. What do you know? What stopped you from asking that in the moment?
Probably anxiety, a little
Anxiety.
anxiety. A student like that says everything is great,
Yeah.
or she thought she did well. I'm never 100% sure of how to proceed because some students don't go on from there.
Right.
They just,
Yeah.
I was happy,
That's kind
I
of
thought it was good.
Yeah, that's their default answer.
Yeah.
Yeah, and so, but you say, I want to see if I understand this. You're saying your anxiety prevents you from digging in a little bit more and getting some more specific.
It's not even
Information.
anxiety.
Not
That's
anxiety.
really the wrong word. It's probably not being sure of how to pass that barrier.
Yeah,
Of
yeah.
what question to ask.
Right. The kinds of students to expect. One of them
Mhm.
is the student who is self-congratulatory.
Yes, exactly.
I did great.
Yes.
All right, what was great? Because maybe what they think is great is not what you think is great, and so therefore that could be your area of exploration.
Mm-hmm. Exactly.
But she brings up an issue. I need to be more sympathetic.
Mm-hmm.
So I want to find out, what do you mean? I don't know what you mean by sympathetic. Can you say a little bit more?
That's,
Because we think they know we know what they're talking about, but they don't. And the parallel is, you may say something as a patient that seems evident. I'm in pain. Yeah, I hear you're in pain. But then they don't go on to explore, well, what do you mean you're in pain? What kind of pain are you in?
Mhm.
What's it like for you? And so that's the parallel you want to do with them.
that's interesting.
Exactly.
Mhm.
I think what what you want them to do with you. But I'm picking up on, I want to get back to your word, though, the anxiety and how that interferes, does it?
I don't think the word is anxiety.
Okay.
I think it's this, and we watched a debriefing where the student said he was anxious because he had this perfectionist thing.
Yes.
And that's probably me. I want it to be as perfect as it can be. So I wait quietly and think in my mind, what is the next proper question to get more information? And that probably may come across as anxiety, but I don't think it's really anxiety. I think it's wanting to just zero right in on the, like you just said, some questions to ask.
So you're eager or anxious to ask the right question.
That's right.
In the same way that they do that with you.
Yes.
And so what happens when you do that? So you say that you analyze a lot. So then that prevents you from being in the moment? Is that what you mean? She brought up the issue of empathy. Do you understand completely what she's talking about?
I think so.
You do.
I think that she just feels if she says the right words,
Yeah.
it's going to
Yeah.
make it right.
Can you get her to say it, though?
I was thinking of exactly that.
Yeah.
What do you mean by empathy?
Right.
And what do you think you might have said
Yeah.
to be more empathetic?
Yeah, I think the place to start is to often just examine the words that they throw out. I should have been more empathic. Well, I want to know, I know what empathy means to me, but tell me what it means to you, because I'm not sure. And that's the student's frame of reference. We want to really find out and model for them an empathic approach. Well, one thing I noticed, and I'm not sure if I have this right, is you gave her some feedback and then some coaching, right? Without the intervening, let's try to work on why you do it that way. Because I'd want to know, I'm curious why you have to ask permission to do the routine. I'm curious why you jump right from feedback to coaching without the exploration.
Because that's my nurturing thing.
Your nurturing thing.
Yes, it is. I'm terrible. I know I am. But I really want them. They're so eager, and they're so young, and they're so happy with what they're doing, that I just want to make their journey easier instead of throwing them out into the woods.
How does challenging them to think make it more difficult for them? Do you think that's making it
don't you think it's always easier to feed somebody rather than to wait for them to eat themselves?
Yeah, of course, and they want to be fed.
And that's my whole problem with everything to this day. It really is.
In other areas of your life? Yeah.
Yep.
Well, you're a nurturing person.
I am.
But with your nurturing, kind nature, you could challenge them a bit more.
I see that.
Tell me more about.
Yeah.
That's really interesting. About you ask permission to do the routine, and it doesn't seem like you have confidence. But I think that you have to be comfortable with being confused.
That's a very good point.
Yeah, and so.
That is a really aha moment.
Really?
Absolutely.
You're so agreeable. What we want you to do is to model how they should be with patients. In other words, doctors should be not so certain and not diagnose within 40 seconds, which they often do, and miss stuff. I'm going to be open to new information and be maybe a little confused, or rather notice when I'm confused and not be so certain I understand what the patient is saying. But they will not learn that until someone models it for them, how it's done. That's why we have you guys do this. Does that make sense? So I wonder why you do that. Is that because you're not sure where to go?
I think it's again the spoon. She was charming, but she was very on the surface.
Well, that's another issue. Students that seem self-reflective still need to be explored, because even though they may seem rather that they have a good understanding of themselves, you may not have a good understanding of what they're talking about, and indeed that's your function is to help them perhaps clarify some of their thinking. I would say the goal of this debriefing isn't so much to help the student, but for you to understand the student, so that you model.
I see.
And then if you made the effort to understand them, that maybe they will get that that's what they have to do with their patients. But until 30 or 40 people give them the experience of being understood or attempting to understand them, I don't know where they're going to learn it.